All right, welcome everybody. My name is Chris Murphy, Senator from the state of Connecticut. We received word yesterday that 4 million people have now enrolled in private exchanges all across this country. In states like Connecticut that have been working to implement the healthcare law rather than undermine the law, we've had absolutely record numbers of enrollment. Connecticut, at the outset, hoped to enroll 80,000 people in our exchanges, and we are on pace in our state to enroll 150,000 people, doubling our initial estimates. CBO has revised their 10-year projections for healthcare spending in this country downward by $1.2 trillion. And 25 million seniors all across this country have received free preventative health care by virtue of the Affordable Care Act. It's time to admit that the Affordable Care Act is working. It's working for millions of people who have gotten access for the first time in their life to affordable quality care. It's working for taxpayers who over the course of the next decade are going to save literally billions of dollars on federal health care expenditures. And as we'll talk about today, it's working for seniors all across this country who, since the outset of the implementation of this law, have been saving thousands of dollars that they were previously spending prior to the passage of this law. So we're launching today a new effort among Senate Democrats to talk about how the Affordable Care Act is working. We recognize the difficulties in the initial stages of implementation. Nobody's denying that there were bumps and will be bumps along the road. That's what happens when you reform 1/6 of the American economy. But the true story is to be told by the millions of people whose lives have been transformed by this act. And that is what our effort will really be all about. We're going to be joining together with dozens of others of our colleagues to both stand together in press conferences with consumers who can tell about how the Affordable Care Act has changed their lives. We'll be down on the floor telling stories about our constituents who are finally receiving care that they've been waiting for decades to receive. We'll be using social media and the hashtag ACA Works in order to tell the real story about how this act is beginning to really work in the ways that were intended. We're also going to be using our group and our effort to push back on the false Republican narrative about the Affordable Care Act. Just this week, Republicans have been down on the floor talking about the changes to the rate that we pay Medicare Advantage plans. We know that for a long time we were overly subsidizing Medicare Advantage plans to provide a benefit that is provided by the federal government for 13% less. And really what we're talking about is a choice, whether you want to subsidize insurance plans or whether you want to provide free preventative health care to seniors or whether you want to eliminate the donut hole. That's a choice that we know where the American people stand. They want us to subsidize their care rather than subsidize the profits of insurance companies. So a big part of our effort will also be, in a coordinated, sustained way, pushing back on this mythology that's been built up by Republicans on the floor of the House and the Senate. Poll after poll tells you that the American people do not want the health care law repealed. Do they want us to consider changes? Absolutely. But they know that their neighbors are seeing their lives transformed as this law goes into effect. So I'm proud to be joined by my colleagues here today who are helping us to launch this new effort. Today, as my colleagues will explain, we're focused on the benefits that are provided to seniors, and we have two Medicare beneficiaries here today, Steve DeWitt and Ken Peace, who will talk in a few moments about their personal perspective on the positive changes to Medicare. But now let me introduce my great friend, someone who was instrumental in getting this law passed from Michigan, Senator Debbie Stabenow.
Well, thank you very much, Senator Murphy. Senator Murphy's a great leader in this effort, and Senator Schumer, Senator Whitehouse, Senator Boxer, all of us working together are here to say that, in fact, the ACA is working for millions of Americans, and as we move forward, more and more people will be able to save dollars, and more importantly, we're going to be saving lives by having access to affordable insurance. Right now, we have over 4 million people who have enrolled so far in the exchanges, both federally and in states. And we have so many others who have been impacted by other provisions of the bill. Healthcare costs are going down. We certainly want to continue to tackle that, but in the aggregate, they're going down, the lowest in 50 years. But what we are seeing is that Republicans stand on the floor of the Senate and the House and out in the media every day saying they want to take away benefits, take away health care for millions of Americans. And nowhere is that more true than for senior citizens and those who benefit from Medicare. There are a number of things, but we want to stress just a couple today. First of all, if you are receiving prescription drugs through Medicare Part D, the average senior or Medicare beneficiary has $1,200 more back in their pocket right now to spend on keeping the lights on, to spend on the heating bills, to spend on doing fun things with their grandchildren, or food on the table. $1,200 on average because of the Affordable Care Act, and that's just for our seniors. In fact, there are over 140,000 seniors in Michigan alone who have gotten savings. And then secondly, when people on Medicare are going to the doctor now for the annual checkup, do you know what they're having to pay out of pocket? Zero. Zero out of pocket. If you need a cancer screening, if you need a mammogram, if you need to have other kinds of preventative care, it is zero out of pocket. These two things alone are important for seniors, and Republicans want to take away, they want to take away, on average, $1,200 that seniors have received, and they want to say that when you go to the doctor, you ought to be paying a copay rather than having a zero-cost checkup. So we're here to say that enough is enough. The ACA is working for seniors, with people with disabilities who are receiving Medicare across the country, and we want to make sure they continue to get these savings and have the access to health and our medical system that they deserve. I'm going to turn it over to our great leader, Senator Schumer.
Thank you. Well, thank you, Debbie. And let me thank everyone for being here, and particularly Chris Murphy, who's leading the charge on our efforts to show all the positive things that are happening with the ACA. Over the next several months, the ACA is going to become less important as a Republican campaign issue because more and more Americans, from young adults all the way up through seniors, are realizing the benefits it has to offer. In addition, the parade of horrible stories trotted out by the haters of this bill will prove not to be true. I had a firefighter in New York City tell me that he's going to lose his health care benefits because of Obamacare. Well, Obamacare has nothing to do with the benefits that a firefighter from New York City has, but he heard it on the right-wing radio. And as soon as he keeps his benefits, he said he was going to lose them January 1st, he's going to realize that that was not true. So the combination of the parade of horribles fading and the good stuff coming forward is going to make this much less important an issue by the time 2014 elections roll around. There are more and more positive stories every day about people. I want to tell you one of mine. I have a friend who goes to a beauty shop in a conservative neighborhood of New York City. The beauty shop owner is very conservative. This beauty shop owner spends a lot of time talking and emailing about politics with her friends, her family, and her neighbors. She's a normal middle-class person. And she was furious when she first went on the healthcare.gov website thinking she was going to have to pay more. She was telling everyone, I'm going to have to pay. She pays for her 8 employees, her health insurance. She said, I'm going to have to pay several $100s more a person. Well, a few weeks ago, this friend of mine called me up and said, guess what? The beauty shop lady finally got through the website, and she's saving $200 an employee. And she's telling people that it's a good thing. I think this story is going to be repeated over and over and over again throughout America. And it will be our job to help make those stories happen. With the improved website, with more and more people signing up for Obamacare, As they experience the positives with friends and families, the positives will increase, the negatives won't go away, but they will decrease, and this issue will not have the vehemence or potency that some of our colleagues on the other side of the aisle think it will. On seniors in New York alone, in just the first 10 months of 2013, 250,000 people with Medicare saved a total of $246 million on prescription drugs, $975 a person. The numbers are going to be even higher when you include the last few months of 2013. So, it's our job to tell the stories, trumpet the positive examples, rebut the negatives, and we won't be shy about it. And you're going to be hearing a lot from us over the next several months. With that, let me turn it over to one of the great leaders in the healthcare area and one of the great voices in the Senate, Senator Barbara Boxer.
Thank you. Good morning, everyone. I'm so proud to stand with Senator Murphy, and I thank him and all my colleagues, but Senator Murphy has really organized us, and this is just the first. As Senator Schumer said, many times you will be seeing us shining the light of truth on the ACA. Truth is the best medicine, and that's what we're going to give as doses to the American people. We're going to tell them the truth. So before I talk for a minute about seniors in my state, it's a wonderful story, I want to talk for a moment about the big picture of Affordable Care Act in California, how every day it's making a difference in people's lives. This is it. More than 2.7 million Californians now have secure health insurance, and we show you how many young adults, 400,000, 830,000 exchange plans, 1.5 million Medicaid. We are ahead of what our goals were. Covered California, coveredca.com is working. And now I'm going to turn to the subject at hand, which is the senior citizens who are really benefiting from the Affordable Care Act in a big way. Now, Senator Murphy alluded to the fact that the Republicans are out there saying how Democrats are destroying Medicare. That is the biggest joke I have ever heard. No one will believe it. It's counterintuitive and it's just plain wrong. We are strengthening Medicare by making sure that Medicare Advantage is fairly priced. Because I was here when the lobbyists for the insurance companies wanted to start Medicare Advantage, and I said, this sounds great. What will it cost taxpayers? And they said, nothing. It's going to be the same price, Chris, as Medicare. Well, it turned out not to be so. So what we're making sure of is that Medicare Advantage is run in the best possible way and doesn't hurt the taxpayers. So we're keeping it going strong, but we're just making sure that it's not wasteful. But the Republicans are spreading false information to scare seniors, and I just don't think seniors are going to believe it because, as was said, they're seeing the great impacts of the ACA. The truth is that the ACA strengthened Medicare and expands benefits for seniors, and we'll just take a look at these benefits, and then I'll get on with it. In California, seniors have saved over $725 million on prescriptions. You saw the national average is $1,200. This is what we're seeing, $900 so far, similar to New York. Remember, we have 38 million people in our state, so we are talking about a big chunk of America here. More than 2 million California seniors received at least one free preventive service. Think about it. Free breast screening, cervical cancer, prostate cancer, colon cancer, tobacco cessation and counseling, diabetes screening, and glaucoma screening. Now, for those of you who are aware of some of these, I'm, I guess, probably the oldest one standing up here, although I feel extremely perky thanks to the ACA. What I want to point out is that these are, yeah, thank you for the Lipitor, President Obama. I want to make the point that every one of these screens, just one of them, is life-saving. Because if you catch colon cancer early, you'll be fine. If you catch it late, you will die. It's as simple as that. This is life-saving screenings that are not costing anything to help our seniors. Well, so I'll close with this. This is a team of people, and there are more of us, that will shine the light of truth on the Affordable Care Act, on Obamacare. We're very proud of what we've accomplished. we know the law isn't perfect. What law is perfect? What person is perfect? We're going to make it better as we go, but we are thrilled with the way it's unfolding at this point. Thank you very much. Let's get this away.
So I'm Senator Whitehouse from Rhode Island, and the first time I visited our exchange, HealthSource Rhode Island, the people who came through the door in front of me were a family of 4. And they had come in earlier that day, and for the first time, they'd been able to get affordable health insurance. So they were now back with 2 big boxes of Dunkin' Donuts and a big hot box of coffee as a present to the staff there to say thank you for what a great change in their lives this had been. And as I walked around the office that day, the people on the phone, you could tell how emotional they were about what they were able to do for the people who were calling in. People who'd saved $600, $300, $200 a month and perhaps got insurance for the first time. So it came as a real surprise when we began to hear the Republican horror stories about these exchanges and about coverage under the Affordable Care Act. And as we've seen, many of those horror stories turned out to have been invented. So let me tell you a few real stories of Rhode Islanders. Olive is a lady in Woonsocket whose husband takes a bunch of medications for his Alzheimer's. They were in the donut hole, and as a result, Olive and her husband saved $2,400 in the last year alone. An elderly couple living in Woonsocket, $2,400 is a big deal. Jay and Audelise A., age 63, moved to Rhode Island for a job that Jay got, and he lost it in the recession. They were without health insurance. They came to the HealthSource Rhode Island, and to quote Jay, it was pretty amazing. It was like a miracle. On a scale of 1 to 10, I'd give it a 10. Lisa P., age 58 in Coventry, has her own house cleaning business after spending years as a musician. She could not get health care. She got it through HealthSource Rhode Island. She went from $600 a month she had for coverage before she'd lost it, saying, I quote, literally had to not feed myself to pay for insurance. And now she's on the Rhode Island Medicaid program, and she says, I no longer worry about losing my coverage. Susan B. is age 52. She's in Warwick. She was self-employed, and like many self-employed people, she'd been uninsured for about a decade. She found her experience with the Navigator to be extremely knowledgeable and helpful. Prior to the ACA, she'd been turned away by insurers, she said, because being an older woman was pretty much considered a pre-existing condition. Now she has health insurance. Ken S. is in his 50s. He has high blood pressure. He lives in Jamestown. He didn't have health coverage because of his pre-existing condition once he was kicked off his earlier plan. His earlier plan was costing him $600 to $700 per month. He got a plan on HealthSource Rhode Island for which he is charged $28 per month. He went from no coverage, he went from coverage at $600, $7 a month to no coverage to now coverage at $28 per month. And the last woman here is Leslie. She's 60 years of age. She lives in Tiverton. She'd been uninsured for more than 5 years after losing her job because of a pre-existing condition. Like many people in that age group, she was just hoping and waiting to make it to 65 so she'd become eligible for Medicare. She told us she was chomping at the bit to enroll in coverage. She has a gold plan with a monthly premium of $217 a month. She says, it feels great to know that I will soon have insurance and not have to worry about this anymore. Not having insurance is something I worried about all the time. Those are the real people of Rhode Island who've been really helped by this bill, not the fabricated people that you see on the TV ads who, when you drill behind the story, you find out there's nothing there but propaganda.
Thank you very much, Sheldon. These are the real stories of people that can be replicated millions of times over. And part of the reason that we decided this week to talk about the effect on Medicare beneficiaries is because a lot of these changes have been in effect for a number of years now. We've almost forgotten the amount of money that seniors are saving and the relief that comes when you show up as a senior living on a small fixed income to the doctor for your preventative checkup, and you don't have to pay out of pocket. And so it's worthwhile right now to remind our colleagues and remind the American public of the hard work that went into getting these benefits earned. So let's hear from a couple individuals who can talk about these changes and these benefits from a first-hand basis. First, from nearby Virginia, let me invite Ken Pease from Fairfax.
Thank you, Senator. Good morning. My name is Ken Pease. I'm 70 years old and I reside in Fairfax, Virginia. I'm 6 weeks away from having Medicare as my primary insurance. Previously, it was my secondary. The Affordable Care Act is important because it gives me peace of mind to know that my prescription drugs, I take 10 a month, will be lower than they would be without it. Repealing the health care law would send those prescription drug bills sky high. In addition, the free preventative screenings offered by the Affordable Care Act are important because I've had serious health issues in the past. I've had a heart attack, triple bypass surgery. I've also had 1/3 of my right lung removed, and I'm a type 2 diabetic. Thanks to the health care reforms, seniors like myself are eligible for free flu shots, prostate cancer screenings, as well as screenings for cardiovascular disease. I'm able to get a free checkup every year. Seniors pay a disproportionate amount of their income to purchase medical services, and that percentage would be even higher without good preventative care. Speaking for my fellow seniors, I am grateful that under the law, health insurance companies are no longer allowed to deny care to older Americans with pre-existing conditions such as I have. Thank you.
Well said, Ken. Let me introduce as well my friend Steve DeWitt from New Preston, Connecticut, who's been a great advocate on behalf of Parkinson's patients, a Medicare beneficiary who can tell you a little bit about his story.
Thank you, Senator. Good morning. My name is Steve DeWitt, and I live in New Preston, Connecticut. The Affordable Care Act is important to me because I know how difficult health challenges can be. I live with one each day. Like almost 50,000 people each year that get diagnosed with Parkinson's, I was diagnosed in 2005. I was 48 years old at the time, and I continued to work for several years, and as long as I could until my symptoms progressed, and I had to accept the Social Security disability and Medicare. I live with Parkinson's every day, but I'm very optimistic that the investments in medical research will yield new treatments or cure for this disease. But the availability of new drugs is not a guarantee that patients will have access to them. My participation in clinical trials provided me with access for free symptom relieving medications through the course of a trial. But at its conclusion, I was forced to bear the high cost of medications to maintain the regimen or face the consequences. While I've been fortunate to never face the Medicare prescription drug donut hole, I have friends that have, and who were forced to make the difficult choices between maintaining health or basic family health necessities. Thanks to the health care law, I feel more secure about being able to manage my health care and my disease. This is a huge relief for me and my family and others with chronic conditions who must rely on expensive prescription drugs. I'm relieved to know that if my condition worsens or the price of drugs go up, I won't hit the donut hole and have to pay entirely out of pocket for these medications. Since I'm dealing with a chronic condition, I know the importance of diagnosing disease in early stages rather than waiting until they progress. I understand that early intervention can make a big difference in the treatment of Parkinson's and other chronic diseases. The law's provisions that provide for annual checkup and all the preventive services without a copay will lead others to pursue services they may not ordinarily pursue. This is not only relieving the financial burden on the individual, but it also reduces overall health costs on the healthcare system. I'd like to thank my home state Senator Chris Murphy for his work on this law and using his voice to defend it. He was my congressman before I knew him as a senator, and we first met at Marty's Coffee Shop in Washington and talked about the broken healthcare system. He's more of a friend than a senator to many of us in the state. I hope Congress will follow Senator Murphy's lead, and I thank the other senators for being with us today and help maintain the provisions of the Affordable Care Act that allow for access to quality and affordable health care, like the elimination of the donut hole and protection for people with pre-existing conditions. I and my family didn't choose this disease, nor did millions of Americans with chronic conditions. Thank you for your help.
Thank you, Steve. And by the way, that would be Washington, Connecticut.
That's right.
Yes.
That's right. I'm sure there's a Marty's Diner somewhere in Washington, D.C., but that one is ours in Connecticut. I just take a couple questions, but just to accentuate something that both Ken and Steve said. They talked about peace of mind. You know, this is about the financial relief that comes to families, but it's also about the psychological health that's delivered when you don't have to worry about the fact that you may lose your home or your car, or your life savings, just because you have the misfortune to get sick. There's no way to quantify that. CBO can't score the psychological health that is delivered by removing the fear of losing everything because of sickness. And that's why these stories mean so much, something that none of us can explain without their help. So with that, we'll take a couple questions if there are questions.
Senator Murphy, is there a reason why there are no Democrats here who are up for re-election in our state?
No, we didn't want to overwhelm you, but there's probably about 20 or 25 Democrats that are going to be part of this effort. There will be members who are up for re-election in 2014 who will join us at press conferences and down on the floor. So this is not an effort that's targeted to people who aren't up for re-election. I think you'll see members who are up in 2014, 2016, and 2018 be part of this
Do you
effort.
think this is something that Democrats still plan to run on, or is it going to be something that they're going to have to distance themselves from?
I hope Democrats, learned from 2010. I think there were a lot of Democrats who tried to pretend that the Affordable Care Act didn't exist in 2010, and they paid a price at the ballot box. There's no mistaking the fact that the vast majority of Americans do not want the Affordable Care Act repealed, but they want it implemented and they want to see it work for them. And so I can't speak on behalf of my other colleagues, but I think you see a very different way in which Democrats are talking about the act in this year compared to 2010. Democrats are proud that they voted for it. There are many that are going to offer and suggest changes, but our effort is one at trying to make clear that now, 4 years into implementation, we're really starting to see in real terms the benefits of the act.
I want to just, if I might just add, what Senator Murphy said was terrific, but let's be very clear about this. When the Republicans are going to the floor in the House and the Senate, when they speak out across the country, they're saying they want to take away that $1,200 for seniors. So they're going to pay more for $1,200 more on average for their medicine. They want to take away the free checkups, the zero cost for annual checkups. That's what they want to do. Nobody in our caucus wants to do that. I don't know anybody in our caucus who wants to do that. I don't know anybody in our caucus that thinks it's a good idea to go back to the time when all taxpayers and ratepayers are paying for people that walk into the emergency room that have no health insurance. Then all of us see our health insurance costs go up. Nobody wants to go back to that. Nobody in our caucus wants to go back to the time when you can pay for insurance, get sick, get dropped, then you can't find more insurance because you've got a pre-existing condition. So we are unified in that. If there are changes that need to be made, we'll be the first one to say that because we want it to work. But what we are committed to is making sure that people are getting what they're paying for, that they have the peace of mind, has been talked about, of knowing that they will have the ability to get their children health care when they get sick, that they will have it, and that they're going to continue to save money on their medicine.
All right. Thank you very much, everybody. Thank you for being here.
everybody.
Thank you to both Ken and Steve.
Yeah. Great. All right.
Appreciate it.